I think we're okay to begin if you are ready to begin, and hopefully you won't mind as you're going through the presentation and the other panelists are speaking to be able to move your presentation along.
Yep.
Okay.
Okay. Good morning, everyone. Thanks for joining us today. It's hard to believe we're at the semester break. We've gone through half a year of school. So what we did today is we took questions that people had submitted in the last week and a half or so, and hopefully we're able to answer all those questions. As we're going through the presentation, feel free to put in additional questions, and if we have time, we will get to them or we'll respond afterward as well if need be. So joining me this morning, Joanne Menrath, our nurse coordinator for the district, Laura Heffernan, elementary principal, and I can't see them, but Dave Domel is also here, our high school principal, and Joellen Gardner, our communication specialist, who will be keeping an eye on the questions that you may have throughout the presentation. So I'm going to begin going through the slides, and we'll get to as many of your questions as possible. So the questions that were submitted have been consolidated. We grouped them essentially into three categories: health and safety, academics, and the overall student experience. And you can submit them, as I said earlier, in the Q&A during the meeting, and we'll hopefully have time to respond to those. So for testing, we had a lot of questions related to testing, and these are rapid tests. We have begun testing our faculty and staff at school using the rapid tests, and we do expect to begin testing students in the next week or so. For the older students, originally we had planned to do our middle and high school students in school for those who had consented, and for the younger students we had done planned a drive-through. We did get questions, and I think they're in here, about the ability to test some of our elementary students in school, and so we will look to do that as well. So have the testing plans changed? Yes, they have. I'm sure many of you are familiar with the different zones that the governor had announced earlier, and the zones seem to have kind of gone away, so to speak. But they were part of what was referred to micro clusters, and in that information, schools were required to test certain percentages of students and staff who were on site. But because we're not mandated to do that, we can use the test. We've received permission to use them for a screening tool. And I know that we did get a good response from parents and staff in regards to the consent. So yes, it's changed and it's ever evolving, like most things these days, but we will be using the test for screening purposes as we move forward. And I mentioned this earlier, yes, we are looking to do this. You know, the one challenge we have with testing during the school day is our nurses are doing this testing, and so they're busy doing other things. So we need to find days that we can bring in some extra nursing staff who we have reached out to. And we do have a couple of extra nurses that will help us with that. So it's not something that we can do on a daily basis, but we will be looking to schedule students for in-school testing within the next week or so. We had great responses for the parental consent to test students. We had well over 2,000 parents agree to consent, just over 600 that did not, and then we had some parents who just didn't respond to the consent. If you've changed your mind about the testing for your child, certainly you can do that. Anytime we test students in school, no matter what age, we would notify you in advance that we would plan to test. So if at any point in time you decided you didn't want your child tested that day, you could certainly let us know, and we would not go ahead with that testing. You can also contact the school and ask for that to be changed as well in our system if you have totally changed your mind. But if there's a given day, it's not a good day for testing, just let us know and we'll be happy to either reschedule that or just forgo the testing. So what does the rapid testing look like? This is our nurse, Kathy Betzel, and this is just a short clip that's on our website.
Hi, thanks for coming today. I want to make sure you had a chance to sign the consent.
Yes.
Great. And also, we're only checking children who are well today. Is your child well?
Yes.
Great. Hi there. Hi. Can you undo your seatbelt and turn your legs around? Great. Now just bring your mask down. We're going to do 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. And you can fix your mask and turn back around. Thank you. Once you're done being tested, you're all set to leave. Your test will be taken into another room to get the results, which takes about 15 minutes. You'll be emailed your results if negative and contacted over the phone if it's positive. Okay, that's it. The test is easy and it's quick. Thank you for helping us to complete this testing. It will help us to plan to keep our school community safe. Be well, BC. Hi, thanks for coming today.
Okay. So will all students be tested? No, we have about 900 of the rapid tests. So the goal is, the recommendation is to test anywhere from 10 to 20% of your students and staff. It's a little uncertain if we can get more tests or not. These came from the state and they gave them to schools during the planning for the cluster zone. So we're not sure of what the availability is for these on a more longer term basis. And I'm going to turn the next few slides over to our nurse coordinator, Joanne Menra, to respond to some of these questions.
Thank you. So what happens if a student or staff member tests positive at school? We would isolate and dismiss the student or staff member. We would encourage them to follow up with their healthcare provider and direct them to the Albany County Department of Health isolation and quarantine protocols. And then our school officials will work quickly to identify and dismiss all close and proximate contacts to that positive individual as soon as possible. And then we would then provide the contact information of those individuals to Albany County Department of Health for their follow-up. So just as a quick note, a close contact is defined as someone who is within 6 feet of an infected person for at least 10 to 15 minutes during the period starting 48 hours or 2 days before symptoms appear, and until that time, that infected person is isolated. So that's our close contact. But the proximate contact is anyone who's in that same enclosed environment, such as a classroom or a school bus, where the individual who has tested positive. So again, all those individuals at this point in time will be quarantined per Albany County Department of Health. Jody again verified that this morning. Just one other piece about the testing, and if someone has, there's been questions regarding this from staff, and I think from some parents as well, is that they've asked, is this test that we're doing a real test? And will my results be reported? So the answer to that is yes. The rapid antigen testing that we are doing in schools is a real test. It must be entered into something called the Electronic Clinical Laboratory Reporting System, or ECLAIRS. And that is a system that provides laboratories that serve New York State with a single electronic system for securing and reporting disease information to the Department of Health and to local county health departments. That's how the health department will also see your official test result. They'll see that result, and if it's positive, follow up with you. It's a way to enhance, I guess, public health surveillance as well. It provides that timely reporting because we're required to submit that, that data very quickly after we obtain your test result. And the health departments use it as monitoring communicable disease in the area. So, So will all positive results be immediately retested to reduce chances of a false positive? If not, why not? No, we will not retest an individual if they have a positive test result. We are doing, as Jody mentioned, the testing as a screening. So if a result is positive, we take it as a positive. We're to report that, that test result to the health department, as I just talked about, and dismiss the individual, provide them with the guidance documents for the isolation and quarantine protocols from the health department, and refer them to their healthcare provider. Will the students be informed of the test results by school officials, or will it be up to the parents? So if a student has a positive test result, as we've mentioned, we will contact you. We'll contact the parent as quickly as possible to inform them of the positive test result and of their need to come and pick up their child as soon as possible, as well as any siblings to that child. The parent may request that the nurse inform the child of the positive test result, because we will call that child down and they will have all their things together. They'll be placed in an isolation room until the parent is able to pick them up. So it would be highly recommended that you as the parent, talk about the testing process with your child before we test them in school, so that they know what to expect if there is a concern with their test result. If an individual has a positive result and a rapid test, do they need a confirmatory PCR test? So the PCR test is that molecular lab-based test. And currently, Albany County and New York State Department of Health has determined that we are in an outbreak situation. So because of that, that means that an asymptomatic individual who tests positive on a rapid test will be considered positive no matter what. And a PCR test will not be needed to confirm that. So again, as a result, the individual will be isolated and their contacts, including our classroom and bus contacts, will be quarantined. And so it's really important for parents to understand that as of right now, if that person chooses to get that additional testing, that PCR test, and it comes back negative, nothing will change. Department of Health will not release that case. The individual will continue to be in isolation and contacts quarantine. Nothing will change that PCR test result, or that rapid positive test result. Should my child participate in COVID testing at school if they had recently confirmed case of COVID-19? That's a very good question. We have been informed that if a child had a positive PCR or a clinically diagnosed case of COVID within the past 3 months, then they should not be tested at school. Some individuals can test positive from anywhere from a few days after recovery up to about 3 months or 90 days. So if a teacher has received both doses of the COVID-19 vaccine, will he or she then be exempt from quarantine in the event of a possible exposure at school? So the COVID-19 vaccine, they were developed to prevent disease in an individual. The CDC states that it's not known yet whether getting a COVID-19 vaccine will prevent you from spreading the virus that causes COVID-19 to other people, even if you don't get sick yourself. So therefore, individuals who receive the vaccine will still need to be, will be required to quarantine if they're exposed to a positive individual. So clearly, this is all very new. The vaccines are new. We're not quite sure how we'll all respond to them. So the CDC is monitoring this very closely. But currently, the guidance is that all individuals, even if you receive the vaccine, will need to quarantine in the event of exposure. If my child had a confirmed case of COVID-19, do they have to be quarantined if they are exposed to an individual who has been diagnosed with COVID-19? So if your child had a confirmed COVID-19 illness in the past 3 months and they've fully recovered and remain symptom-free, then there's no need for them to quarantine after a COVID-19 exposure. So that's why it's important. The nurses, we have that information, so we can provide guidance to you, and you can certainly communicate with us as well. But it's really important to remember that there have been documented cases of reinfection. So if your child develops symptoms at any point during that 90-day period, your child must be evaluated, they must be isolated and possibly retested. That's really a decision to make with the healthcare provider. So again, I think there's this mindset that, all right, my child had COVID, they're having symptoms, I don't really need to keep them home. I don't think it's COVID, it can't be COVID. So, but the important thing is that it's something, can be something communicable. So therefore they need to be evaluated and followed up with a healthcare provider. So the New York State COVID-19 Toolkit, this was a document that came out, it was released to school districts on October 1st, and it really has been the foundation for, the basis for everything we do regarding health-related concerns involving COVID. And so I just wanted to draw attention as we talk through and answer some of the questions. We'll often reference this toolkit. And just so you know, some great news, it's under revision currently, and we're expecting there to be some new guidance in it. They may relate certainly to changes in the quarantine period, but we're expecting it to be released soon. And when it is, we'll post it on our district website for your review. So again, what happens with my child wakes up sick, what is required for them to come back to school, and this is where the toolkit comes into play. So it says that students with one or more symptoms of COVID-19 must remain at home and be evaluated by a healthcare provider and have one of the following: that negative lab-based COVID test result, or a healthcare provider's note explaining the diagnosis of a chronic condition with unchanged symptoms, that's key, and that COVID-19 is not suspected, or a healthcare provider note that explains the diagnosis of acute conditions such as the flu, strep throat, and again, they must say that COVID-19 is not suspected. So the district had adapted a form from the New York State-wide Center for School Health to help guide parents and help them navigate what they need to do when their child is absent and how to get them back to school. So again, those 3 items that we talked about that are required for your child to come back to school, one of those 3 items you can see are listed here, and you can use this and bring this to a physician or use it as a guide as you talk to your child's healthcare provider. If my child is sick, is evaluation by a healthcare provider and a COVID test required? So we know from the health department that COVID-19 testing is essential to the appropriate identification and containment of cases in Albany County. Therefore, they strongly recommend testing and medical evaluation if a student or staff member is symptomatic. However, if symptomatic students do not get evaluated or tested, they must remain home in isolation for at least 10 days and meet the following criteria. At least 10 days have passed since the onset of symptoms, and 72 hours of being fever-free without those fever-reducing medications, and their symptoms are improving. So the guidance that came out from Albany County in December said that school nurses would be working with the families and they would be able to clear them and allow them to come back to school if all of these criteria are met. And if you look back to that toolkit, you'll see that this criteria if a symptomatic student does not get evaluated or tested is the same requirements for an individual who has tested positive in order for them to come back to school after their isolation period. Why do we have to keep our child home if there is a household member who is sick? In January, Albany County had advised school districts to exclude siblings of symptomatic students from attending in-person classes pending that COVID-19 test result. Given the current level of community spread, the likelihood that COVID-19 illness in excluded students is high. It recommends that those household contacts also be, okay, the likelihood, all right, this is a little confusing. We have found that there was a number of parents and other contacts in the household who may have been symptomatic, who ended up being positive for COVID. So the district and many other districts in the area expanded the guidance from Albany County to exclude keeping students and staff home when any member of their household is symptomatic. And this decision was, again, based on data that was collected from the families who were reporting a child testing positive and having other family members also testing positive. So what if my child has a sibling who is home as a result of being quarantined due to their own possible exposure? Do all of my children need to stay home? No, in this case, Albany County would consider the other children contacts of a contact. These contacts of a contact are not required to quarantine and come to school, but the only exception would be is if your child who is identified as a contact becomes symptomatic. If that child becomes symptomatic, then all siblings and actually household members should remain at home and should be quarantined. But if you have any questions, feel free to reach out to your school nurse. If the symptomatic household member had a negative rapid test, could the child come back to school? although testing of symptomatic individuals can be done with either a rapid test or a lab-based PCR test, Albany County states that if the rapid test is negative, a lab-based PCR test should be done and will be required to confirm the result for return to school. So that was focused on students and staff. However, the question has to do with, like, if there's a symptomatic household member, for example, as a parent. So if the parent had a negative rapid test, could their child come to school? So we talked about this last week with our school physician, and it was recommended that we apply the same principle to all household members. So if there's somebody who's symptomatic in the household, that they too have that lab-based PCR test before their child can come back to school. If my child is sick and you're equipped to do rapid testing at school, can you just test my child? We will not be performing rapid testing on symptomatic individuals, so we would not be testing your child. And again, it goes back to, although testing of symptomatic individuals can be done with a rapid test, it is that lab-based PCR test that is required. And really what's important to know too, and to draw attention to, is going back to the toolkit. If your child is sick, they need to have an evaluation by a healthcare provider. They just don't need to have a rapid test done at school. They need to be evaluated by their physician or other healthcare provider. So your child's sick at school, we will isolate them, we'll evaluate them, and we'll send them home if they are presenting with symptoms of COVID-19. How does the Department of Health, oh, that's Jody, that's you.
I'm going to give Joanne a break right now.
Thank you.
Thank you, Joanne. You always have so much knowledge. So how does the Department of Health address cases of COVID-19 at school, aside from, much of what Joanne shared? We do work closely with Albany County, and they use a combination of case investigation and contact tracing. And, really, it's interesting. Every case is unique. The health department reviews the history of the symptoms. So when did the symptoms begin? If they didn't have symptoms, when was the test performed? Because they use that date for the exposure. And I know there were a couple questions related to that. And then contact tracing focuses on individuals of the person diagnosed with that came in contact with on the dates that the Department of Health identifies as the exposure dates. So follow up the possible exposure. I know it gets, our communication about is there exposure or not, it goes back to the health department and when did they identify the individual as being symptomatic. So if someone is symptomatic, the Department of Health asks us to go back 48 hours, they're essentially 2 days, to identify any close contacts during that time. And if they're not symptomatic and they just have a COVID test, they'll use the test date and look back 48 hours. And so when we talk about in our communication, there's exposure at school or not exposure at school, it's really dependent upon when did the individual become symptomatic or when did they get tested in a 48-hour window prior to that. So we do have many students since the holidays who have been virtual, so they're still required, and we're still required to report those cases. But because the students are virtual, often that's why lately you've seen there's no exposure at school because those individuals are virtual. And what is our role in contact tracing? So we work with Albany County. They have school specialists. Generally they call me and let me know there's a positive case, or oftentimes we hear from parents that there's a positive case, their child is tested positive, or if it's a staff member. And then from that information, we work with Albany County to determine when the symptoms began or when was the test date performed. We confirm the attendance at school, and then we provide Albany County with any close contacts that will need to quarantine. So that's really the process. Obviously, the goal is to expedite the quarantine process and contact information so the health department can then follow up with those individuals. Seating charts, we do ask our teachers to keep seating charts. We keep seating charts on the buses. And we've been doing that since the beginning of the year. However, currently, due to the level of community spread, Albany County Department of Health does continue to quarantine both close and proximate contacts that Joanne mentioned earlier. So the result of that is entire classrooms and buses are quarantined when there's a positive COVID case with exposure. And now I'm going to turn the next few slides back to Joanne.
So my child has been quarantined. What does that mean? So quarantine, again, is used to keep someone who might have been exposed to COVID-19 away from others. It helps to prevent the spread of disease that can occur before a person knows that they are sick and they are infected with the virus without feeling symptoms. People in quarantine should stay home, separate themselves from others, monitor their health, and follow directions from the local health department and their provider. When can a student return to school after quarantine if, for example, they're exposed to COVID-19 on February 1st? So it's important to know that the quarantine period is 10 24-hour periods. So if your child's quarantine starts on February 1st, your child completes the 10th 24-hour period on February 11th, and your child can return to school on February 12th. And that's important because I think it's been confusing to parents because they'll see these dates, they'll see the 1st to the 11th, and they think, oh, I can come back to school on the 11th. No, you have to complete the 11th day. It's the next day that your child can return to school. But what's important, we'll talk about this in a moment, is the quarantine period has changed. It's now 10 days, but you are still responsible for monitoring your child's symptoms for a full 14 days following that exposure date. So here we go. If the quarantine period has changed from 14 days to 10 days, why does the daily COVID-19 screener tracker ask the following question? Has your child been designated a contact of a person who tested positive for COVID-19 in the past 14 days? So it's a great question that someone asked. So again, if you recall back in early December, CDC had changed their guidance regarding the quarantine period, reducing it to 10 days from 14 days. And then on December 31st, New York State Department of Health changed the quarantine period to align with the CDC guidance. However, the incubation period for COVID-19 is a full 14 days. Therefore, individuals must continue daily symptom monitoring through day 14. And it's really important that you as parents do that. So part of the reason it's on this tracker this way is just as a reminder to continue to monitor your child. We've had several individuals who became symptomatic after day 10. So just because your child comes back to school doesn't mean you stop monitoring them for potential symptoms. What if I receive a red thumbs down after completing the daily tracker for my child and I'm advised that my child cannot come to school? What happens next? So first of all, you contact your child's main office to report that absence, and then you contact your child's school nurse to talk through the situation, and she will provide you with further guidance. That communication with the nurse is just so essential. It's important that you keep that communication going. Even for the secondary students, when it's an A-B rotation, your child may not be in school that particular day, it's really important that you still complete that tracker. And if there's a question or a concern regarding it, you get that red thumbs down, please reach out to the school nurse. If you can't reach her by phone, please send an email and she will get back to you.
I think the next few questions, I'm going to turn over to Dave Hurst and give Joanne a break again.
Okay, thank you. So the first one deals with SATs, ACTs. As of right now, yes, they're scheduled to be administered in the spring. And as we just learned, the SAT scores can actually be used in place of the PSATs for the National Merit Scholarship Program. So that was good news as well. Yes, last spring, growing to maturity was not covered at any of our elementary buildings. So in the coming months, grade 6 students will be working through the growing to maturity curriculum with their physical education teachers. Prior to that, a parent preview night will be held and a letter would go home regarding the program. So technology professional development has been very much at the forefront of what we've been doing. And this really isn't something new. Ever since we created the one-to-one program, I guess we're going on our 4th or 5th year now, we've been offering extensive professional development for teachers in technology integration, not just how to use the tools themselves, but how to appropriately incorporate the tools within their pedagogical practices. So, there's two pieces. How exactly do you use the tool? And then how can the tool be leveraged to improve instruction? Those are really our 2 points of focus. In this past year alone, we have the teachers combined for over 6,000 hours of professional development surrounding tech integration, curriculum instruction, and assessment. One of the questions that came about too was if there's an incentive program, and we do have an incentive program in our teacher contract that allows teachers to be paid at a rate of $22.50 per hour for completing professional development hours. They do have to complete a minimum of 5 and no more than 17 hours. And then as an additive incentive for teachers to actually provide the training, they're eligible for an additional 10 hours. So the reason behind canceling the PSAT, sort of twofold. One is that, as I already mentioned, colleges will be able, or the National Merit Scholarship Program will be able to use SATs to determine eligibility. So that was sort of one of the hurdles. And then the other one was that, we've been having to go to virtual days far too often recently, and to just schedule a virtual day for the sake of having students take this test, it didn't seem to merit the benefit. Also, the PSAT is essentially a practiced opportunity for SAT. And when you look at the options available both online and in print, there are more than ample opportunities for students to practice SATs at home. So once the National Merit Scholarship piece was taken care of, it was really an easy decision to wait till spring to have the students take the SATs. So the next question deals with homework help, tutoring, enrichment programs, et cetera. As you know, we're very limited in terms of what we can do before and after school, as we've limited in-person availability. But, first and foremost, students should really be working with their teachers if they find that they're struggling. As you know, our teachers have been extremely flexible with their time. We have teachers working with students. I know some teachers have been working with students 9, 10 o'clock at night with flexible office hours. We also have the National Honor Society tutoring program that is a huge benefit to students. Even at the elementary level, we have students reaching out and taking advantage of high school students tutoring through the peer programs. And, all I can say is students are routinely encouraged to reach out for help. Both their teachers and their counselors can help through that process. So is there a way to provide virtual lessons to students who are home yet still able to participate in school? So, as you know, grades 6 through 12, we live stream every day. So regardless of whether you're in person or at home, you're essentially getting the same experience. We decided to not take that approach at the K-5 level. We do not believe that live streaming is an effective method of instruction for K-5, which is why we set up the Virtual Learning Academy to begin with. We believe that a more purposeful, direct approach where the teachers and students are all in the same environment, that being virtual, is more appropriate. Enrollment in the Virtual Learning Academy does open up every 10 weeks, and we've had students come and go at each of those transition points. So when students in grades K-5 are quarantined, or families simply decide to keep their students at home, this is really intended to be a short period of time. And for short periods of time, asynchronous learning options are made available. And we find that to be the most appropriate way of handling this. Given that students have access to Seesaw and Google Classroom, they're able to still complete many of the same assignments as the students attending in person. And I already talked about grades 6 through 12. So as of today, yes, there will be meetings in June, but yesterday the state did release a survey looking for feedback on all testing coming up this spring, 3 through 8 testing, special education testing, English as a new language testing, and Regents testing. So that is still be a to be determined item, but as of right now, they are being planned, and they do have, New York State Ed does have the requirement that examinations have to be taken in person. So what that looks like for our fully remote students, we'll have to come up with an option for them to safely come into school to take those exams, as there will not be an at-home option. And the same can be said about this grades 3 through 8 testing. As of right now, We are still planned to offer the state testing. Students at home would not be able to participate in this testing, as a requirement is you have to be on site. But again, the state is investigating a federal waiver at this point as well. So this is a pretty course-specific, teacher-specific question in terms of open book test options. All assessment design and options are developed by either departments or teachers themselves. So if you have questions regarding the type of test students are taking, you should really have your student reach directly out to their teacher to inquire about alternative testing models. So in terms of this whole concept of, this term learning loss seems to have been thrown around a lot since last March. And I want to be really careful. Kids don't really lose learning. This was sort of something that every year we talk about, the so-called summer slide. Similar to you don't forget how to learn a bike. You don't really forget how to do certain things. You might not have it in the accessible part of your memory because you didn't use it all summer or you haven't used it for a while. But you're not really losing learning. So really what this means is that, as students are in school, these sort of bits and pieces that haven't been accessed recently, they really require reassembling. And that's what our teachers are working on, is reassembling students' knowledge, extending students' knowledge. Learning it's pretty complicated. I don't think you can really look at a single assessment to determine this idea of learning loss, which many would argue is not a real thing. So what I can say is that our iReady testing data is showing that our students are performing on average similar to our historical trends. We've really leveraged our smaller class sizes this year, especially at the K-5 level. Students now are in classes of 15 to 18 students as opposed to 22 to 28 students, and has really allowed our teachers to provide remediation enrichment opportunities that go above and beyond the typical differentiation strategies that they've used in the past. So I would say that the plan is, with smaller class sizes, we were adequately able to address student needs. We also had, over this past summer, we worked on our curriculum, grades K through 12, to really take a look at prioritizing our curriculum. The way the New York State standards are written, they have what are called major clusters, supporting clusters, and additional clusters. And we made a real focused effort to ensure that, our time was spent digging as deep as possible into the major clusters, and then simply utilizing the supporting and additional clusters as necessary to ensure that students would be well set to move on to further work. So this is another big concern, the social emotional impact of COVID. There's no doubt that COVID has taken a toll on everyone, not just students. So some of the things that we're doing are, at the high school, we have monthly newsletters that are going out. We have social workers, we have student assistance counselors that have been working with students since last March. We do now have a virtual calming space for students and staff. We have individual Google Meets going on with students to be able to check in. At-risk and disengaged students are identified and being handled by members of, and this really goes to all of our buildings. We have coordinated care teams that meet regularly and talk about students during mental health meetings, pupil study team meetings, child study team meetings. We've done home visits. We are in the process of doing a wellness survey. And again, I think this goes back to, the smaller class sizes at the elementary level has certainly helped. It's always been a fact that elementary teachers get to know their students on a much deeper level than secondary, just because they spend the entire day with them, as opposed to changing classes throughout the day. So having smaller class sizes have allowed teachers to really, keep a good know of where their students are standing in terms of their mental well-being, and they're able to loop in counselors and principals as necessary. And like I said, grades 6 through 12, the teachers are keeping an eye out, social workers, counselors. And all I can say is that if you're noticing at home, a change in your child's demeanor, then I would encourage you to reach out to a counselor for help with your child. So I addressed this back in the fall as well, screen time, and I'm again going to caution that not all screen time is equal. there is a certain amount of screen time that it's required, right? We have students, especially at the secondary level, that are only in school every other day. So they have no choice but to use screens to engage with classes. So that being said, we still encourage students to get up and move around regularly during breaks, right? Even if it's simple as getting a drink of water, stop to play with the dog. You can't just simply sit in front of a screen all day. You have to find time to find these breaks. We've been very fortunate that the weather has cooperated this year. There's been very few days that kids could not get outside during long breaks or after school. And again, I'm just going to reiterate this whole idea of not all screen time being created equal. There are several studies that have taken a look at really 3 different types of screen time. Passive screen time, such as TV. Yes, that's the one that's been associated with poor outcomes, right? Educational screen time, such as using the computer for homework or watching lessons, either recorded or live, it was still associated with positive educational outcomes. And then interactive screen time, such as playing video games, does have some positive associations with educational outcomes because you are actually working your brain as you play those games, but it could have negative associations with other outcomes such as social interaction and things of that nature. So really all I can say is, monitor your students' screen time to ensure that they're using it for the appropriate reasons, and that when they have opportunities to get outside and to do other things, then that should be encouraged. So grade 6, as you know, this year we had to redo the schedule so that it had more of an elementary model. Looking forward, if we're able to go back to a traditional middle school schedule, then yes, languages would be back. If we have social distancing guidelines still in place that do not allow us to go back to that type of schedule, if we're still placed in the same situation we were this year, then unfortunately that might be something that would have to continue. And I will turn it back over to Jody. Thanks.
Thanks, Dave. We had several questions related to vaccines and our district employees who interact with students required to get vaccinated. So currently, employers cannot mandate the COVID vaccine. We have been encouraging staff to get the vaccines, and we've had, you hear a lot about people unable to get appointments, and we've had some good fortune, and we have about 50% of our staff who've been able to either get a first vaccine. Actually, some of our individuals, like our nurses who are identified in the 1A, have been able to get both doses. And then we have individuals who have appointments that are scheduled. So we're hoping that if supply does increase, that those will increase as well. But we've been pretty fortunate so far to be able to get as many people with appointments as we have. Higher risk sports. This was a little bit of a shock, I think, to everybody last week. However, the governor in New York State Department of Health essentially said that they would allow this, but the local health department had to agree to move forward with these sports with whatever restrictions or parameters they felt was appropriate. So the Department of Health, Albany County, has said that they will make a decision, I think, later this week in regards to what sports will or will not go forward. So we're still awaiting guidance, and is currently fall 2 is planned to begin March 1st. I don't know if that's going to change if winter sports do happen. And spring sports are scheduled to begin, I believe, sometime in April. I don't have the exact dates, but with everything these days, things could change very quickly. So we are waiting on further guidance regarding sports. I'm going to actually ask Dave Domel to respond to this, because I believe he sent something out recently about special events for the seniors particularly. So Dave, could you address this and maybe share who they could contact about this?
Sure. And I plan on sending it out again as well, because I sent something to all senior parents should have gotten an email. And if you didn't, please let me know. Basically, the email just had contact information such as our PTO reps, our senior class advisors, which involve our student council, our advisor, our staff advisor, as well as the students that are the officers, and included our student senate reps as well and their staff advisor. Last year, what worked really well, I know that there's parents, thankfully, that are more than willing to not only just provide support, but generate ideas and also fundraise, which is amazing. And that happened last year, and it's starting to happen this year again. And what took place last year and worked really well was combining the efforts of the parents in the community with the students and student groups that we have here. And it kind of streamlined things so that it wasn't all over the place. And I wasn't trying to take ideas from the community, bring them back to the kids, ask them if they thought they were good ideas, if they wanted to go through with them. So I encourage everyone to, I know there's also a Facebook page that I shared out that you can get involved in, but I encourage you all, if you have questions, those are great places to start because it goes through the senior groups and it gets shared with the students so that they're involved with the process as well. We have some things already we have planned. Something that's going to go out to every senior is going to get something they're going to get their own Valentine. That's a secret though, so don't tell them, which is something that they haven't had probably since elementary school. So we were lucky enough, Stewart's helped us out as well as some of our senior students who provided a gift for each senior. So there's some things that we have that are going to be happening, and hopefully, as Jody said, hopefully the restrictions aren't what they were at the end of last year. It was really tough last year there because of restrictions. So hopefully as we get going here through the end of the year, we'll be able to do some really fun things. And, but like I said, ideas, sometimes even last year, there were some great ideas that were generated from the community. And I encourage that as well this year, please.
Thanks, Dave. And just to add to this, I don't think there was a question about this, but I know at the elementary, parents have been asking about spring activities as well. And so we are having discussions about some of the things maybe we've done in the past, or maybe some new ideas that we have that can be done safely. Hopefully we have a mild spring and we get outdoors as soon as possible and can hold some of those activities. So we definitely want to try and have some of those activities that we've had in the past, or a version of them at all levels. So we're definitely having conversations about those things. Is there a plan to remain in remote hybrid model to return to full-time in person for the fourth quarter? So right now, because of the social distancing requirements, we can't have everyone back at the secondary level because of the space restrictions. So if those social distancing requirements were to be lessened, then certainly we could have the space and get everyone back. But I'm not sure they're going to be loosened that much this school year. Indoor visits with individuals who have been vaccinated. So we still are following the CDC and DOH guidance about no outside visitors. That's what's recommended. Social distancing, wearing of mask is definitely, you hear it all the time, one of the safest precautions we can follow. So at this time, we're not having outside visitors. Again, as we've mentioned, perhaps if the community spread becomes less, perhaps vaccinations become more widespread, and we start to see more positive trends, we can look to opening things up a little bit, but currently we don't have that guidance. How will students be held accountable when they break the regulations with behavior in school, refusing to cooperate? So, I think you've probably heard from the Department of Health that people are not always forthcoming when they're trying to do contact tracing. We did put in place in the fall expectations as part of our reopening plan that kind of aligned with our code of conduct. It is on the website. And if someone were to blatantly disregard our safety protocols or not be honest and truthful with us or the Department of Health in an intentional manner, there are consequences for that. To be very honest, most of the students have been really great when they've been in school as in regards to adhering to our safety protocols. So we haven't had any issues, but we do have a plan if things are not adhered to and if people intentionally violate the guidelines in our safety measures. In-person classes are low. You're right, at the high school and the middle school, they're lower ever since the holiday break. We've had some families opt and some students say they wanted to continue virtual. We have heard that some are waiting to the semester break. Some are saying they're going to return after the February break. So we can't just say anyone who wants to come back, because the issue that is we could have one classroom that might have too many students in the classroom with the social distancing requirements, and other classrooms that have 5 students in them. So it doesn't really work that well to just open it up. Certainly if things were to change, and we heard from a lot of families, which I hope will not be the case, that they would prefer to stay virtual for the rest of the year. That might change our planning. But at this point, we are anticipating that as the community spread lessens and the numbers go down, and we've heard from many families that they are planning to return to the hybrid model of instruction. A skills level support model for identified students for, I'm guessing this is for virtual. So you can't just take programs that are in place and make them virtual. Skills programs for students who have IEPs are a program that are offered on site. I think we know that things such as physical therapy or occupational therapy don't work quite as well in a virtual environment as it does in person. But any student who does have an IEP, we do provide the services, and some of them might be a little more limited if the child is virtual, but our goal is to meet the needs of all students, including those who have IEPs. I wish I had a crystal ball for this question. What will next September look like? Hopefully we will be back in person, live in person with everybody. That would be our goal. However, we also have to be realistic that there may still be some restrictions in place. Some of it will depend on, I think, the vaccine rollout and what the numbers look like. But so we are planning for a couple of different options, that we would return fully in person. Maybe we still have to have some kind of hybrid model or a lesser number of students in buildings as we begin to roll out our budget process, which begins in the next month and continues for the next couple of months. We are being mindful of the fact that we might find ourselves somewhere in the middle, and we're hoping that we won't be where we are now or where we were in the fall of this past year. And our goal would be to have everyone return to in-person, but I'm not sure that will be fully able to happen. So we'll hope for the best. And I did want to give Laura Heffernan has been here, and I know there's probably some K-5 families. So maybe Laura, maybe if you just want to share some things that are happening at the K-5 level that have been going well, so people can hear a couple of things from you as well.
Well, we've been very impressed with how the students have been managing all of the COVID restrictions. It's very impressive to see, children as young as 5 years old wearing their masks and staying away, 6 feet apart as much as possible. It seems to be going as well as we can make it. Obviously, it's not ideal. We have had to move the specials to virtual for the past few weeks, just because the numbers in the county are so high, the positive numbers. But PE teachers are going outside in, 30, 40-degree weather whenever possible, so that the kids can get outside and move. I know the teachers are also taking their students outside when possible. And we're just grateful for the parent support too. I know pickup and drop off can be challenged, and we're so thankful for all that you're doing with this and with everything else with your children. We're trying to do some fun things. We have a Tuesday, Thursday trivia contest every morning, Tuesdays and Thursdays at Glenmont, for example. We are, as Jody said, talking about some special events in the future, hopefully as the weather gets nicer. So we're just trying to stay positive and keep the learning going.
Thanks, Laura. So Joellen, are there questions that came in during the presentation?
Yeah, there are a few. So some of them have been answered already by some of the other panelists, but I'll go ahead and ask some of the questions that we have. The first, not all counties quarantine entire classrooms or buses. Some only quarantine close contacts within 6 feet. Can the school board advocate for a change to more closely align with some of the other counties' quarantine guidance? It seems like that would help with staffing shortages.
So I think Joanne mentioned earlier, I have asked Albany County a few times about the quarantining, and early in the fall, the process for quarantining was that we use seating charts on the buses to identify close contacts. And since later in the fall, when the numbers started to show some increases, and certainly through the holidays, because of the community spread, Albany County has indicated they will continue to quarantine entire classrooms and buses. I am hopeful that if the numbers, or I should say when, I'm trying to be positive, when numbers start to decline in the community, that I think that Albany County will revisit this process. I know that Dr. Whalen is aware of the impact it has on the local schools when you are quarantining, and I've shared this with many people. One positive case often results in anywhere from 5 to 7 staff members, sometimes more, sometimes 8, and sometimes up to 60 students having to quarantine. So that's a lot of people impacted for one positive case. And I know that we have had several meetings with Dr. Whalen and Albany County staff, and they are aware that it is a burden. It does require us to go virtual, perhaps, than maybe other schools in other counties. But because of the community spread, they will continue to quarantine in that manner. And the Department of Health is the lead agency in these situations, and school districts are required to follow their guidance.
Okay, next, this is not a question, but it looks like a parent has posted some useful sports schedules that were updated apparently today by Section 2. So Section 2 is looking at if there's a winter season that would end March 13th, Fall 2, March 7th to the 1st. And it looks like Section 2 is saying spring would run from May 3rd to June 25th.
Thank you.
Okay. Next, I don't know, maybe Dave Domel could answer this. How will full virtual seniors be included in the special events for seniors?
Yeah, that's a good question. I mean, last year we did have people that chose not to participate in some of the events that were, live. We had something at Jericho Drive-In. We had graduation here in person. So, I mean, those students that are 100%, virtual, that are not interacting or not coming out, there were some virtual options. There was a virtual awards night. There was a virtual senior superlative video that was done. So there's a mix of options. Not everything can be transferred, obviously, to a virtual world, but there will be. I'm assuming that this year there will be again, a mix of options.
Okay. And I'm not sure if this is still here, but somebody had asked how they would access sort of the list, Dave, of who to contact about maybe ideas for seniors. That's something we can put right on the website. So
yeah, we can put that on the website. And I actually comment to that person. They can contact myself or Rhonda Bowl, who's my secretary. She has that information. Has sent it, forwarded it to several people. I will resend it after this to all the senior parents again, just so everyone has it, one more time. And then Joanne, if we want, we can throw that up on the website. I think I shared it with you.
Okay, sounds good. Okay, this question may be Jody and Dave Hurst. I'm not sure if you can answer this. My son goes to the Center for Disability Services, and his therapist is not allowed to travel to his school. Can you give me more guidance on when this might be allowed again and why she cannot go at the moment, with both schools having in-person learning taking place?
So Dave had mentioned earlier, or actually I think Laura mentioned it, about we've been having our specials teach virtually even though students are on site. And really that was to minimize quarantining, because individuals who do related services as well as specials are going in and out of multiple classrooms and potentially increasing exposure, which potentially would warrant more quarantine. So because of the high rates of community spread, we have asked not only related service providers who travel in our district, but also outside the district to do virtual instruction for the last several weeks, just like we've asked our music and art teachers to do the same if they couldn't take kids outside. So we're hoping that if things improve, our goal is to obviously have that instruction be live in person, whether it's in our classrooms or in other buildings. But really it was to minimize exposure.
Okay, next, and Dave Hurst is going to answer this question. If a virtual student is failing courses, what happens?
So, this is really no different than students that are in person. It's still fairly early in the year. I would encourage students to work with their teachers closely to determine sort of a path of success. At the end of the year, we're still working out what options we would have for students that if they're unable to remediate any failures by June, what that would look like over the summer. We're still sort of awaiting guidance as well. As you know, last summer, schools did not run traditional summer school programs. So once we're clear on what types of options can be made available to students over the summer, we'll get more information out on that as well.
Okay, thanks a lot. So Joanne, you're back on. I know you thought maybe you were finished, but I just have a question about the rapid testing. So, and I think you covered this in a couple of different ways, but this is sort of a direct question. Why are you potentially instituting the rapid testing of students to remove a student from school if positive, and then requiring a PCR test in order to return? It is generally understood that the rapid test is less reliable. Is this, in fact, the plan?
That was a great question, very well thought out. We had been told by the health department, actually there's a guidance document that's called the outbreak in a general public setting, which is currently what we're in. And so if we are testing an asymptomatic individual is what we're doing in the school setting, an individual without symptoms, and they test positive, they are required to go out and to be isolated and context quarantine. That's per the health department guidance. For an individual who is symptomatic, who is sick with symptoms, We cannot accept a negative rapid test because of the reasons you mentioned, is that it is not as reliable, and the PCR molecular lab-based test is that gold standard. And so we can't accept a negative rapid test there for a symptomatic individual. We need to have that PCR test for that individual in order for that person to come back to school. So I know it's a little confusing, but it's based upon the DOH guidance and is looking at whether someone's asymptomatic or symptomatic. And if you have additional questions, feel free to reach out to me and we can kind of talk it through, because it has definitely been a little bit confusing for us all.
Okay, thanks a lot, Joanne. I think you're done now. So I think we're good. So, and I think this will be the last question, and it really had to do with, and it's gone now. So I think Dave Domel answered it, but it was about, being able to contact families.
Sorry, Joanna. Yeah, I just answered it. So it was just about, there was something recently that the seniors did receive a treat to Dunkin' Donuts. And apparently the parent was asking if we could make sure that we remind parents to have their students check their email because it was sent through the promotion, or the offer was sent through email. And I'll do that, but I'll also make sure that if we do that in the future, I guess I'll CC parents on it as well. So, they can see it and remind their student, to check their email.
Thanks, Dave.
So did we sort of answer all the questions?
I think we're done, actually. Yes.
Okay. All right, I'd like to thank our panelists, Joanne, Laura, and Dave, and certainly Jo Ellen for always, being so great at making sure all the questions get responded to. I'd also like to thank all of our families for your continued support. I know that it has been, a challenging year, and there's been certainly ups and downs, and we're working our way through it. But I know that it's required a lot of flexibility on your part and a lot of patience. And, as I've mentioned a couple times, things change regularly. And so I really appreciate all of that you've done. And the students have just been great. And really, we're hoping that we will have more of our secondary students return to our hybrid model on-site instruction. And we'll keep everyone informed as much as we can as we move forward. And hopefully we'll have some really, positive things to look forward to in the coming months. So thanks so much for your time, everyone, and have a great day.
Thank you.